This week's health question is, what are some major risk factors for heart disease?
Well, we've got the expert here. What are the major risk factors for heart disease?
Yeah, so
male, over 60.
Yeah,
over
no,
50?
I think certainly age and gender. So males, again, over the age of 55 to 60, the presence of hypertension, high blood pressure, essentially, diabetes, abnormal, so what we call dyslipidemia or high cholesterol. Family history is a big one.
Yeah, that's an important one. That means a heart attack in a first-degree relative at a younger than 50 or so.
Yeah, and I think first-degree relative meaning parents or siblings, direct blood siblings, who share 50% of your DNA.
What about smoking history?
Smoking's a big one, not just for coronary disease, but also for peripheral vascular disease. And so tobacco is a huge risk factor and something that we really try to
sedentary lifestyle.
Sedentary lifestyle, being physical inactivity is another one. Low HDL, which is the good cholesterol, believe it or not. So that's another one. So there's a whole host of
so we get a pretty good picture of somebody's cardiovascular risk without doing any special studies. In fact, there are ways now we can estimate based on statistical algorithms exactly what your risk is. And that's something you can ask your doctor to do if you want.
Yeah, and some of these things you can change. Obviously, you can't change your genetics, but it sounds like from the discussion we just had that there are a lot of things that we can affect and
absolutely,
change.
Becky. Yeah, absolutely. And there are risk calculators online. Framingham as one for patients.
And that's all we have time for.
Yep.
So
thank you.
We definitely have to have you come back, John.
Yeah, absolutely.
Great discussion.
Thank you.
If you have a question you'd like to ask Vicki and me and one of our guests on Health Talk, please contact both of us at healthtalk@norohealth.org.